Two quick questions, and my time has expired. One, is it common for us to see 24% increases in premiums on the Part A and Part B side, on the doctor and hospital side of Medicare? And secondly, at this kind of rate, wouldn't we need to have, isn't that a perfect example of why we need some kind of competitive model that gives us a chance to make sure that we do try to keep a lid on prices going up for consumers of that health care?
Yeah. You're right that the Part D premiums have increased substantially. It's not entirely clear why that is. Let me list a number of potential factors. One could be that's a byproduct of pricing strategy that companies decided to lowball, aggressively price at the beginning of the program to maximize their market share, and now that they have enrollees, they're backing off and trying to recoup. A second potential factor could be that there's inadequate risk adjustment. We've been looking at the risk adjustment in Part D and see some indications that for the high-risk patients, it may be inadequate, and we've sent some data to CMS for them to look at. A third possibility, as I mentioned earlier, is that more people could be getting drugs. You know, the whole purpose of this was to assure that Medicare beneficiaries had access to needed drugs, and we may be successful at that. More and more are getting on. That doesn't happen overnight. It takes some time, and that may be good news. It may help us hold down some other costs. Or it could be, and it could be, these aren't mutually exclusive, it could be some combination of all these. It could be that a bigger and bigger share of the drug bill is moving towards very high cost, single source drugs, biologics, for example, where private purchasers have great difficulty sitting across the table from a monopolist and negotiating a favorable price. So as I say, it could be some combination of all those, and there could be some additional factors as well. We will be looking, as we get the claims information, we'll be looking at trying to figure out exactly what's going on here.
But do we see in Part A and Part B the same type of 24% increase in premiums?
No, we don't.
Okay. And final comment on whether or not, if we had a public option available to Medicare consumers, that they could shop and have a way to try to have a better competitive price to choose from among the plans if you had a public plan that was out there?
Yeah, we've not looked specifically at the issue of a public drug plan. I would say that in general, we think that Medicare benefits from having both a public plan and private alternatives. We think that they have different strengths, and in some ways complementary strengths. A public plan has economies of scale, lower administrative costs, and pricing power. Private plans have greater flexibility in payment methods, the ability to identify efficient providers. And so the solution isn't one or the other. We need both.
Right. Thank you so much. Mr. Chairman, thank you. Yield back.